Good evening. Tonight I'll be doing my presentation on PTSD and the treatment of exercise within the first responder population. My Pico question is, in the first responder population, that being fire, EMS, and law enforcement, diagnosed with post-traumatic stress disorder or PTSD, can exercise be utilized as a treatment technique to manage their symptoms as compared to current other methods? A little bit of background, what is PTSD? PTSD is a traumatic event that can cause helplessness or horror in response to the threat of injury and or death. PTSD can lead to major depression, panic disorders, generalized anxiety disorders, and substance abuse. Exposure to a traumatic event is then they can respond to these events with fear, helplessness. They can also include re-experiencing, avoiding reminders, trying to avoid anything that's going to trigger an event, and hyperarousal for at least 1 month. So that's the kind of the criteria that needs to be used to diagnose someone with PTSD. Before we move on a psychological aspect, these events can also lead to someone feeling vulnerable, powerless, horror, anger, sadness, humiliation, and guilt. To include the wishing of trying to alter the former events to avoid this feeling they're feeling right now. So on a biological aspect, it is really a huge biological, more of a brain chemical disorder than that of a physical injury. That's why it's fairly hard to study itself, at least right now. So in a biological aspect, there's increased levels of norepinephrine and reactivity of A2 adrenergic receptors, and thyroid hormones levels are increased. All those are involved in the stress response within the body. There's also alterations within the amygdala and the hippocampus, and these areas are involved in response and traumatic memory recollection. So with these increase, they're going to then kind of play into that re-experiencing and that constant replaying within one's head that causes that stressful environment. So now we might be asking why first responders. So first responders, are involved in environments that include in physical exhaustion, smoke, heat exposure, and sleep restriction. All of those things are involved in PTSD and increase the prevalence rate for PTSD. As you see this little graph off onto the right of the screen, the ones that are highlighted are all ones that first respond are directly related or exposed to. As you see, it's a pretty significant amount of the list to include some of the ones that are higher up on the list as far as prevalence rate. First responders have a prevalence rate of 32% of PTSD, while the generic population of those that are not involved in first responder population or roles is 6 to 14%. So you see nearly a twice the increase as far as prevalence rate. Pretty significant if you ask me. So now you might be asking, well, why exercise? So exercise, just right off the bat, enables a individual to safely and at a higher capacity perform tasks, right? That muscle, the increase in strength allows you to lift heavier boxes, that sort of thing. Well, if we relate that to occupation, firefighters, law enforcement, and EMS members have to be physically demanding jobs. Therefore, if you can't perform very well, you're going to have an increased rate of stress. Increased stress, inability to perform, opens up kind of a concoction to be able to be exposed to a PTSD event. So that's why this fitness thing is going to help a little bit further. Fitness can also improve body compositions that are also associated with a better capacity to tolerate heat. As we kind of mentioned earlier, heat environments are one of those that does lead to a further increase for PTSD, especially within the firefighter population, directly related. So now we kind of look at how does that relate to what we've seen so far. So I found 3 studies that really relate directly to this, which I thought were pretty beneficial. So one study involved 9 individuals that were used with prolonged exposure, one treatment to treat PTSD, and that of exercise. So they did this in kind of 2 steps. One, they looked at elevated brain-derived neurotropic factors, which is a measurement, and they also used a PTSD symptom scale interview, which is more a little subjective, but they put in an objective standard onto it too. So BDNF plays a role within the kind of that condition of fear, and higher levels indicate a greater ability to learn new materials, and in this sense, be able to overcome trauma, so overcome those PTSD experiences. So what this found is that the group that was the prolonged exposure and exercise had better scores on both the PSSI as well as the BDNF post-exercise, post-treatment, as compared to that with nothing, as compared to that with only the PE. Another study I found took a war and torture survivor, and this individual went 3 months with 2 weekly sections that each lasted 90 minutes. In pre and post exercise interviews, the interviewer found that they had a better or greater increase in enjoying life, having fewer depressive moods, and being able to be more active and motivated for living. This was definitely a better result following the exercise as compared to when they did a little bit more of a control rate before. And the last thing I found was 19 studies were examined that utilized aerobic exercise for PTSD. So repeated exposure of stress via exercise can also lead to a desensitization in PTSD stress. They're trying to use that as in, let's overload the body with stress from exercise, and maybe the stress of the PTSD will subside, and that's actually what this caused. Cardio and aerobic exercise has been shown to positively affect memory and lead to desensitization, a huge role within PTSD. And then exercise has also been shown to decrease the stimulation of the hypothalamic pituitary axis. One second, Alexa, pause. Excuse me. So the Alexa, pause. So exercise. Excuse that. Where was I? So exercise has been shown to decrease the stimulation of the hypothalamic pituitary axis, and this is also involved in the body's stress response. So that a PTSD is exactly what we're trying to focus and target on. So now trying to put it all together, I put this slide in here with a little bit of a sense of humor. These are obviously comics that have been taken. So we see a law enforcement officer with a donut that's slightly overweight and a firefighter who's focusing on one sort of strength training and not involving the cardiorespiratory fitness, which we just saw cardio directly helps. So why are they missing that out? We understand that, we're making this joke, we understand they're an unfit population, or they're a fit population that's just not focusing on everything. But do first responders realize how important exercise is as far as mental health? So my current clinical recommendation is all first responders should be involved in some sort of regimented exercise program to better their performance within their occupation, like we identified earlier, but also to desensitize themselves with stress to be able to better appreciate or better equip themselves to deal with stressful situations and hopefully reduce PTSD in that sense. And then take it a step further. Any first responder that is diagnosed with PTSD, they should be put on a exercise regimen to hopefully try to manage their symptoms as well. And this is more so a tool within a toolbox. I don't think this is going to be a one-stop fix, solve everything. They should also be referred to a therapist or whatever other treatments that a department may have available to them. I think this is definitely going to be a beneficial tool. So taking this a little bit even further, I think it'd be very beneficial to conduct a randomized research trial on first responders with PTSD, and one of those treatment groups being that of exercise. The only problem with this is, do you put one treatment group with exercise and one group with nothing and let them, in less of better words, suffer? I question how ethical that would be, but the research behind it would be beneficial for this sort of study. And so here are my resources. Thank you.